Today in this lecture, we will talk about the integrated response of osmoreceptor ADH and thirst mechanism in controlling the plasma sodium concentration in plasma osmolarity. So we have this graph which is showing the daily intake of sodium on the x-axis in milliequivalent per day, and on the y-axis we see the plasma sodium concentration or plasma osmolarity. Now the reason to discuss is that when both the osmoreceptor ADH and the thirst mechanisms are intact, both of the systems, they will not allow the plasma osmolarity or the plasma sodium concentration to increase, even if the intake is increasing. Suppose, for example, here the intake is around 30 milliequivalent per day, and the intake has increased by so many times. It has increased by 6 times, but there is very little increase. There is very little change from this normal level of plasma sodium concentration and plasma osmolarity. Very little change, even with a very big change in the intake of sodium. And it is due to the integrated response of the osmoreceptor ADH and the thirst mechanism. Now, if one of the system is blocked, for example, the osmoreceptor ADH is blocked and the thirst mechanism is intact, this system will still work and it will maintain the plasma sodium concentration to the maximum possible range. But if both the systems are blocked, the osmoreceptor ADH system is blocked as well as the thirst mechanism are blocked, then you see that even with little increase in the uptake of sodium, or decrease in the uptake of sodium, it will cause a tremendous change. It will cause a very big change in the concentration of plasma sodium concentration as well as the plasma osmolarity. So this lecture is about the importance of the integrated response when both the systems come together and they try to maintain the plasma sodium concentration as well as the osmolarity. So when they are acting, or either one of them is acting and normal, it will try to maintain the concentration or within this small range. But if both of them are blocked, then you see there is the change in plasma concentration. It will be very big. It will be this much. You can see it here from this way to this one. By increasing the uptake of sodium, the concentration has increased when both the systems are blocked. So that's all about the integrated response of osmoreceptor ADH as well as the thirst mechanism. Thanks a lot for watching the video.